Lung, as we know, is that, the biggest cause of cancer-associated death, and smoking is the thing that we can do to stop our future risk of developing cancer. So stop smoking is an absolute must. Certain jobs, for example, will be exposed to asbestos. So things like in the timber industry, there might be associations with lung cancer there. I think symptoms is really important. So people will often have a persistent cough for well over 2 weeks before they will present to their GP. So understanding that a persistent cough for more than 2 weeks is actually an NHS reason to go and visit your GP. And if you did have that and you were to go and visit your GP, they would see you immediately and they would do a lung cancer risk check. So it's about understanding those symptoms and then knowing when you can actually go to your GP. Coughing up blood is another sign of lung cancer, and even chest pain as well, and shortness of breath. So things that we should be looking out for on a regular basis. In terms of breast cancer, I think changes in this shape or size, or any lumps, but also skin changes. People don't realize that sometimes overlying skin on your breast and changes in that can actually be a sign of breast cancer as well. So informing and allowing people to understand what they would need to see their doctor about is very important.
Yeah, makes sense. And then you talked about bowel, obviously, in terms of, it is on the rise. So this feels like a really important one for everyone to sort of keep an eye on, really. Would you just talk us through this?
Yeah, absolutely. So bowel cancer is on the rise. We know that it is partly associated with family history, but also lifestyle choices as well. And so changes in stool, so what your stool looks like and what your pattern looks like, that can actually be one of the biggest markers of bowel cancer. And people often don't really necessarily pay attention. And when they go to the GP, actually they've been having these symptoms or changes in their stool habit for well over 6 months. But actually doctors want to hear about these changes so that they can investigate and go down the standardized pathways. So changes in stool is very important, seeing any blood in the stool, and then unexplained weight loss or anemia. And anemia is a paleness, feeling rather low in energy. Sometimes you get paleness in the reds of your eyes, and these can be signs that you are losing iron through your bowel, and that one of the reasons for that is associated with bowel cancer. So again, awareness of these symptoms. Prostate cancer, I'll just briefly touch on, tends to be in the slightly older male population, and it doesn't really show up other than sometimes changes in the sort of pattern and frequency of passing urine. And so GP practitioners will normally send men for a PSA blood test, which may be raised, and then they will go down a particular prostate cancer pathway.
Okay. And again, here, early testing is key, I think, isn't it? And prostate is one of those things that we can kind of do the early screening on.
Screening blood tests can be the difference between an early stage and a late stage diagnosis in prostate cancer.
Yeah, for sure. Okay, and then these two, I mean, we're trying to sort of focus on 6. So these sort of final 2, I guess, in terms of what are the risk factors? How can we just keep our eyes on what's happening here?
Absolutely. So I'll go to head and neck cancers first, actually. So most people sort of think that smoking is related to lung cancers, but head and neck cancers are cancers essentially of your oral cavity, your mouth, and sort of the back of your throat. And these cancers are directly associated with smoking and alcohol, and they're more common in men. Often if there's poor oral hygiene or dental checkups haven't necessarily been adhered to. So symptoms can be really quite as simple as things like ulcers in the mouth, or a redness in the roof of the mouth or on the bottom of the mouth, or red or white patches. And then when we think about the lymph nodes in our neck, are there lumps and bumps in and around our neck area that aren't going away after 2 to 3 weeks? When we have common colds, when we have a virus, we get lumps and bumps in our neck, but these tend to go down. So really it's about evaluating these and sort of questioning how long have they been there? Does this feel right? Or actually, should I go and see a GP about it? And again, that lifestyle change there around the smoking and alcohol, particularly in head, is very important.
Okay. Did you want to touch on skin in a bit of detail? Or?
Yeah, absolutely. So skin cancers are directly related to UV rays from the sun. And so the advice is about being sun safe, which means reducing your exposure to the sun, using things like SPF, so high SPFs of 30 or even 50, but also being aware of any changes in your body and on your skin. We're very much prone to getting skin cancers on our face, so any changes around your nose or your cheeks, but also changing moles or new moles as well. 9 out of 10 melanomas are caused by direct exposure to sun. So if you do start to get moles which are now changing in shape, are bleeding, have a discharge, these are the things that need to be evaluated by your doctor, and they will then go through, again, the skin cancer pathways available.